Hello everyone, I am Dr. Neha, practicing doctor at Bharat Homeopathy. In today's video, we will talk about CKD, that is chronic kidney disease. It's a progressive gradual decline in renal function. During the whole day, we talk, we eat, we sleep, we run, and during all those activities, our body produces a lot of toxins. It is our kidney that removes those toxins via urine. Now, because of a number of reasons, if those functions are altered, due to a number of reasons, if your body is not able to excrete those toxins out of your body, you may develop CKD, that is chronic kidney disease. Now, how will you identify whether you have developed CKD or not? A case that is in the early stages of chronic kidney disease usually do not present with any symptoms. It is later in the stages that patient come in OPD with a number of symptoms. One very common symptom is a change in urine. The patient may experience that the urine has either increased or decreased, or maybe the person is experiencing some burning in the urine, or the patient may say that there is froth after passing urine. So this is one very common symptom of a kidney case. Second very common presentation is swelling. There can be swelling maybe in hands, on face, and one very common area is around the ankles. If you press a finger on the ankle, you will feel some pitting over it. That is called pitting edema, and it actually represents there is protein leakage. Third common symptom is a change in appetite. The person may experience that there is a very low appetite. The person do not feel like eating anything. Whenever he does eat anything, he feels nauseating or he might end up vomiting. The other common symptoms are weakness, cramps, or maybe shortness in breath. These are very common presentation with patients of CKD that come in our OPD. Now that we have understood what are the common signs and symptoms of a CKD case, let's talk about what are the reasons of a CKD. One very common reason is a long-standing case of diabetes or hypertension. If the person has controlled BP or controlled sugar for over probably past 10-15 years, eventually the patient develops CKD. Or you might also experience that over a couple of years, the blood pressure and the blood sugar levels are not under control, then it can also lead to CKD. The main reason behind this is because the circulating high sugar in the blood actually gets deposited around the filtering unit of the kidney. This is the main reason why your kidney does not function properly. Other common reasons are genetic disorders, maybe IgA nephropathy, polycystic kidney disease, or you may also experience a case that has a recurrent tendency of renal calculi, or maybe recurrent renal infection can also develop CKD. Now that you have understood the reasons, the signs and symptoms of a chronic kidney disease, it is very important to know that what are the tests that actually denotes or lets you know that you have developed CKD. One important test is renal function test, that is KFT. And the important parameter that you have to look out for are serum creatinine levels. The normal serum creatinine levels are between 0.3 to 1.3. The higher the creatinine levels, the higher the kidney dysfunction. Other parameters that you have to look out for are blood urea nitrogen, potassium levels, phosphorus levels. One also important thing that you have to keep in your mind is in a case of CKD, there is a rapid loss of hemoglobin and calcium. So you have to keep a watch on it. In case you have rapid declining hemoglobin levels and calcium levels, you need supplements for it. Second parameter that you need to get tested are urine examination, routine examination that is. For that you have to look out for is there any protein loss in the urine or not, whether the RBCs are lost in the urine or not. These are the parameters that will tell you how much of kidney disease you have developed. Third important test that a person can go for are ultrasound. Ultrasound specifically talking about KUB. So in that ultrasound you will get to know what are the shape, size of your kidney, whether you have any calculus or you have any cyst or not in your kidney. All these three tests that I've talked about are the prime test to know whether it is a CKD case or not. Now, even if you have developed CKD, or you are experiencing any of the symptoms that we have talked about, there is nothing to worry about. Do not panic. Just get in touch with our team and they will help you with it. Also, you have to keep in your mind a good diet, a very, very good diet that is specifically designed for CKD, coupled with homeopathy treatment, can help you benefit CKD.